Welcome to respiratory tract pathology. The first section is the nasopharynx. The first disorder to discuss is rhinitis. Rhinitis basically is inflammation of the nasal mucosa. You know that the nasal mucosa is lined by respiratory type epithelium. Adenovirus is the most common cause. This classically presents with sneezing, congestion, and runny nose. So basically your common cold. Again, adenovirus being the most common cause. It is also possible to get an allergic rhinitis, and this would be an inflammation of the nasal mucosa due to a type 1 hypersensitivity reaction. And of course, with a type 1 hypersensitivity reaction, we're going to be looking for an antigen, and in this particular case, you'll find one. For example, pollen would be something that could elicit an allergic rhinitis. Because this is an allergic type reaction, it's going to be inflammation with eosinophils, and it's going to be associated with other types of atopic disorders such as asthma and eczema. Now, one of the consequences of rhinitis, and this is probably the most high yield in this particular discussion, is that you can get nasal polyps. So patients who have repeated bouts of rhinitis, they develop nasal polyps. And a polyp, again, is just a protrusion of edematous inflamed nasal mucosa. All right, now here comes the high yield. The first high yield is that if you have a child with nasal polyps, you really want to think cystic fibrosis. Again, very high yield. If you have a child with nasal polyps, you want to test that child for cystic fibrosis, and that becomes particularly high yield for examination purposes. The second high yield here is that there are a subgroup of adults who also develop nasal polyps because they have something called aspirin-intolerant asthma. This is a triad of asthma, aspirin-induced bronchospasm, and nasal polyps, and it's seen in 10% of asthmatic adults. So remember that patients with aspirin-intolerant asthma can also develop nasal polyps. So those are the two high yields on this slide. The next disorder is angiofibroma. Angio means blood vessel, fibro means fibrous tissue, and of course oma means mass. So this is a benign tumor of the nasal mucosa comprised of blood vessels and fibrous tissue. Again, the name gives it away. Now, one important thing, and very high yield, it's only seen in adolescent males. That's the classic demographic. It is very, very, very rare in a female. So for your purposes, it's basically a tumor of adolescent males. And these can bleed because of the large blood vessels, and so they can present with profuse epistaxis, and that's the classic presentation, especially on examinations. Nasopharyngeal carcinoma is a malignant tumor of nasopharyngeal epithelium. Of course, it's arising from the nasopharynx, hence it's nasopharyngeal, and it is epithelium, hence the word carcinoma. So the name really tells you a lot there. Now, basically, this is an EBV-driven tumor. That's particularly high yield. Also high yield to know is that it usually arises in two demographics, African children and Chinese young adults. The classic presentation is that they give you, especially on examinations, a Chinese adult who has an enlarged cervical lymph nodes, because this tumor usually can spread to the cervical lymph nodes very quickly, and it classically presents with involvement of the cervical lymph nodes. A biopsy is then performed, and the biopsy shows this classic finding, which is pleomorphic epithelial cells in a background of lymphocytes. Now, these epithelial cells are scattered within the background of lymphocytes, and so often you have to prove that they're actually epithelial. And so keratin is often performed in these to ensure that there is a carcinoma. And so it's very high yield for purposes of board examination to know that this is the histology. And what they like to tell you is that there's a Chinese male, he presents with cervical adenopathy, a biopsy is performed, and that the pathology report says that there is pleomorphic keratin positive cells. Of course, keratin positive means that these are epithelial, because keratin is the intermediate filament in epithelial cells, and so once you have keratin positive cells, you know that you're dealing with a carcinoma. And so nasopharyngeal carcinoma is a classic entity you think about with this particular story. As far as the larynx is concerned, the first disorder is acute epiglottitis. Acute epiglottitis refers to inflammation of the epiglottis. The most common cause is H. flu type B, and this is the most common cause both in immunized and in non-immunized children. So H. flu type B is the most common cause in both immunized and non-immunized children. Now, you're well aware of the fact that the epiglottis sits at the back of the throat behind the tongue, and so you get inflammation, massive inflammation of the airway, and so you can see what an inflamed epiglottis might look like. and the patients will present with high fever, sore throat because of the inflammation in that region, and then they get drooling with dysphagia because of the fact that the epiglottis is swollen and hence the airway is compromised. They have a muffled voice because they're speaking with something in the back of their throat, and they have inspiratory stridor because of the compromise to the airway. And this is really the key thing that you have to worry about, which is that there's a risk of acute airway obstruction. So this disorder is a medical emergency because you need to protect the airway in these patients. Next disorder, laryngotracheobronchitis. So again, the name tells you that you're getting inflammation of the upper airway. Most common cause is parainfluenza virus, and these are the patients that classically present with this hoarse, barking cough and then an inspiratory stridor. So that's laryngotracheobronchitis. Vocal cord nodules are nodules that arise on the vocal cord, and it's classically due to excessive use. So because it's due to excessive use, it's often bilateral. So you'll see one next to the other. These are composed of degenerative myxoid connective tissue, and it's going to present with hoarseness because of the disruption to the vocal cord. Now this is a wear and tear issue, and so it occurs because the patients have had excessive use, and of course it will resolve with rest. Here's what it looks like. You can see one vocal cord nodule here, another one here, and these are bilateral because of the fact that it's due to a wear and tear or use related problem. Now here's what you see if you were to do the histology, and all I'm trying to highlight here is that you get myxoid degeneration of the connective tissue, which leads to the formation of this vocal cord nodule. Laryngeal papilloma is actually a tumor of the vocal cord. You get a papillary or finger-like projection off the vocal cord, and it's benign. Of course, it's very important to know that it's due to HPV 6 and 11. That's high yield. Laryngeal papilloma, HPV 6 and 11. Of course, because it's HPV, it's going to be associated with coilocytic change were you to see it on biopsy. Very high yield to know that laryngeal papilloma is single in adults. It's usually one single lesion in adults, but that in children it's multiple. And of course, because you have disruption to the vocal cord, it's going to present with hoarseness. Laryngeal carcinoma is a squamous cell carcinoma that arises from the lining of the vocal cord. Recall that the vocal cord is actually lined by squamous epithelium, and so it's not anything special here that laryngeal carcinoma would be a squamous cell carcinoma. You're well aware of the two risk factors, alcohol and tobacco. Those are the two key risk factors for laryngeal carcinoma. Now it's important to note that rarely you can get laryngeal carcinoma from a laryngeal papilloma. Remember from the prior slide that laryngeal papillomas are due to HPV 6 and 11. Remember that 6 and 11 are low-risk HPVs. Now remember, we don't call them zero risk. We call them low risk. There is a risk for cancer, but it's very low. So it is possible to get laryngeal carcinoma from HPV 6 and 11, but again, that would be rare. Of course, because you've got disruption to the vocal cord, you're going to get hoarseness, and other signs of advanced disease would be cough and stridor. And so these are some of the key presenting signs with laryngeal carcinoma. And that concludes this particular section.